So genomics in primary care is clinically very valuable, as it is all about early detection and prevention in primary care practice. It requires addressing clinician confidence, of course, and time constraints and equity. Yes, hi, my name is Isa Houwing. I'm a consultant in the Department of Family Medicine and Clinical Genomics here at Mayo Clinic in Rochester, Minnesota. I'd like to share some insights from our upcoming article in Mayo Clinic Proceedings, which will be published in January 2026. The title of the article is Ethically Integrating Genomics in Primary Care, an invitation to share implementation best practices. Genomics in primary care is all about equity, person-centered medicine, and prevention, of course. And it really enables early detection, personalized treatment, and prevention. It requires addressing clinician confidence, of course, time constraints, and equity, of course. So the article really gives an overview of all of this, and our group of experts in this field really was able to bring all of these insights together in this wonderful article. So primary care is really ideal for prevention, early diagnostics, and continuity. And it really shows that we can work together with laboratory scientists, of course, about what kind of testing is ideal, but also with clinical genetic counselors before genetic testing is required, and also after genetic testing is done, for explaining what these testings might be, how this may be of value to our patients. But there are also some barriers, like lack of guidelines, but also lack of education for primary care physicians, of course, and some disparities where we see that not all people are currently being tested, sometimes due to race, but also cost because of income. So, and we feel primary care practice is the ideal situation to break these kind of barriers. Some ethical priorities, of course, are avoiding these racial biases and then assuring access for underserved communities. Because we know our patients in primary care practice, we have long-term relationships with our patients, of course, and we know their background, and we can put them in contact with clinical genomics, and possibly also talk about these insurance reimbursements that would make it possible for them to get referred and get tested. I think the future line is really about cascade screening, for example, and for those family members who have not been tested yet, to get screened as soon as possible, because early detection and early treatment will put them at lower risk of developing certain diseases like cancer or diabetes or familial hypercholesterolemia, but also earlier detection of rare diseases, for example, where there's often a very long journey before being detected and being treated sufficiently. But also pharmacogenomics, where inefficiency of certain medications for which there's a gene drug recommendation in place, or side effects really can make a big deal to patients when it's about pain medication or antidepressants, for example. So pharmacogenomics is also a really big part, of course, of primary care practice, where there's still a lot of research that needs to be done to make effective implementation become real world practice. It's all about personalized medicine, and not so much a guideline for the whole group of people or for a whole panel, but really individualizing this and bringing medicine to the individuals in our practice. Other next steps in research, I think, is also about AI and machine learning, and finding risk of disease early, especially in primary care practice, where we work with AI and machine learning in our electronic healthcare records, and through shared decision making can think about early referral or testing with our patients. To learn more about strategies and ethical considerations, read our full article in the January 2026 issue of Mayo Clinic Proceedings.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.